Hello, everyone. Bonjour tout le monde.
Good morning, everyone. I'm happy to be here today with Minister Leblanc, as well as Doctors Tam and New. Today, I will be speaking about our fight against COVID-19 and the measures that we are taking to create jobs and build back a cleaner Canada. This week is National Nursing Week. It's an opportunity to highlight the importance and expertise of nurses within our health system. Of course, it's also an opportunity to thank them again for their work. It's thanks to the efforts and dedication of nurses across the country that we have been able to get through this difficult year.
Yesterday, I met virtually with nurses in Manitoba to say thank you for their incredible work and to hear how things are going on the ground. I got to hear firsthand how exhausted they are, but also how determined they are to continue to be there for Canadians. So to nurses across the country, I know this past year has been tough and that this third wave is even harder. But you keep stepping up for your patients and for Canadians. Thank you for your dedication, your skill, and your compassion. Our government will continue to be there for everything you need, from vaccines to rapid tests to PPE to everything else. Our fight against COVID-19 is not over. In many parts of the country, cases are still too high and hospitals are still under incredible pressure. But there is hope. More Canadians are getting vaccinated every day. Almost 50% of eligible adults have received at least one shot. Canada is in the top 3 countries in the G20 in terms of daily vaccinations. By summer, we'll have enough vaccines so that every eligible Canadian will have gotten their first dose. And by September, as we've been saying for months, we'll have enough doses for every Canadian to be fully vaccinated. So here's the situation. More and more Canadians are getting vaccinated, but like we know, cases in far too many places are far too high. We can't ease public health restrictions until cases are way down. We all want to have a summer where we can see our loved ones and invite friends over for barbecues. We can have that summer. We can have a one-dose summer. But for that, 2 things need to happen. First, restrictions need to remain in place until cases go way down with more screening, testing, and contact tracing. We need to successfully limit community transmission. Second, as Dr. Tam said, at least 75% of Canadians need to have received their first shots. And we need to keep ramping up those second doses. If we can do this, then we can have a more normal, better summer. And a one-dose summer sets us up for a 2-dose fall, when we'll be able to talk about going back to school, back to work, and back to more normality. That's what the coming months could look like. That's what I'm excited about. And that's up to all of us by remaining vigilant, following local public health guidelines to drive case numbers down, and getting vaccinated. Jusqu'à maintenant,
to date, we have delivered nearly 20 million vaccine doses to the provinces and territories. Next week, as with each week in May, we will receive 2 million doses of the Pfizer vaccine. In Quebec, vaccination is progressing very well. I would like to thank everyone who's part of this incredible effort to keep Quebecers and Canadians safe. If it's your turn to get vaccinated, do your part by making an appointment. Let's continue to all work together to put an end to this pandemic as quickly as possible. Across our country, efforts are continuing to fight the third wave. Our government is ready to do everything necessary to support the provinces and territories and all Canadians.
In the last few weeks, Nunavut has seen a spike in COVID-19 cases. As soon as numbers started going up, we moved quickly to keep people safe by sending more PPE and medical equipment. But even more help is needed, so that's what we're going to provide. We're working with the government of Nunavut and the NTI on additional and immediate support for Nunavut. This funding will help with everything from food security to communities with active cases to providing better IT equipment for students who need to do remote learning to additional health supports to protect people. Our government's priority is to keep you safe no matter where you live. And that's exactly what we're going to continue to do.
As I said last week, we are also continuing to help other countries that have been severely affected by this crisis. This morning, I can confirm that a second aircraft from the Canadian Armed Forces departed for India with medical ventilators, which we have a surplus of, to help support their hospitals in the fight against the virus. We know that to get rid of this pandemic once and for all, it needs to be stamped out across the world. The fight against COVID-19 is a global effort, and Canada will always be there to do its part.
Ending this pandemic is job one. But as we come into what's hopefully the final stretch of this crisis, we also have to look to building a strong recovery for every Canadian and every community. On that note, today, I want to talk about another major step we're taking to make our communities more connected, create jobs, and fight climate change. We've reached a historic agreement on public transit in the Greater Toronto and Hamilton area. If you live in the GTHA, even if you're working from home right now, I don't have to tell you what traffic's like. After a busy day at work, you want to spend time with your family, not hours commuting. Not only that, but heavy traffic also causes a lot of pollution. That's why we're working with Ontario to make improvements to public transit that people in the GTHA can count on. We're investing over $12 billion, including in 4 subway projects in the GTA and 1 rapid transit project in Hamilton. To begin with, we're investing in the Ontario Line project, which will bring rapid transit from Exhibition Place through downtown to the Ontario Science Centre. Anyone in Toronto can tell you that the subway is way too busy. Sometimes in rush hour, people have to wait for 2 or 3 trains to go by before they can even get on. This major investment will not only help deal with that, but also create thousands of good jobs and get gridlock traffic off the roads. The second project for the GTA is the Eglinton Crosstown West Extension. This will create a continuous rapid transit line along Eglinton Avenue between Scarborough and Mississauga, a part of the city that needs better crosstown service. Again, this will create jobs, lighten traffic, and keep air in the GTA cleaner. The third and fourth transit projects we're investing in for the GTA are the Yonge Street North Subway Extension and the Scarborough Subway Extension. On Yonge Street North, we're extending Line 1 north to Vaughan, Markham, and Richmond Hill. If you live in the north of the city, this means cutting down your commute by almost a half an hour. For people in Scarborough who don't currently have good transit options, this investment will mean 3 more stops along Line 2. That's what this investment means for the GTA. Here's what it means for Hamilton. We're going to provide major support for rapid transit in Hamilton for a line that will go from McMaster University in the west through downtown all the way to Eastgate Centennial Park in Stoney Creek. Just like the transit projects in Toronto, this will support jobs, make people's commutes better, and cut down on pollution. This $12 billion in funding means people will get where they need to go faster, all with tens of thousands fewer cars on the road daily. In addition, part of this funding will go toward buying zero-emission streetcars for the TTC. Not only will these new streetcars help Toronto's air cleaner, this deal will also help protect good middle-class jobs at the Alstom automotive plant in Thunder Bay.
This streetcar order for Toronto Public Transit will also help support factory workers at Alstom in La Pocatière. Canada is a world leader in the public transit manufacturing sector, whether it's for zero-emission buses or subway or light rail cars. We will continue to encourage this industry in our country.
Minister McKenna will share more details about these investments later today and throughout the week. The federal government always listens to Canadians, which is why we pushed hard for key conditions in the funding agreement to improve the outcomes from the projects, including community and environmental benefits, affordable housing, and more citizen engagement. But the bottom line is this. Rapid transit shortens commutes, which gives parents more time with their kids and ensures kids will inherit a cleaner future. Public transit is at the heart of a strong recovery and a growing middle class. It's also part of our plan to reach net zero by 2050. Investments like these are key to making communities more livable and affordable, communities people can love to call home.
By working together to improve Canadians' quality of life now and for the future, we will rebuild a stronger, cleaner country for everyone. Thank you. And I'm now happy to give the floor over to Dr. Tam. Teresa.
Bonjour à toutes et à tous.
Good morning, everyone.
National trends are slowly declining, but we've still got a number of areas across the country that are experiencing ongoing resurgences. Over the past 7 days, an average of 7,275 cases have been reported daily, and the number of people experiencing severe and critical illness remains high. On average, 4,000 people with COVID-19 were being treated in our hospitals each day, including over 1,400 in intensive care units, and there were an average of 49 deaths reported daily. This week, Muslims across Canada and around the world will end their month-long fast of Ramadan with the feast of Eid al-Fitr, a spiritual celebration acknowledging the provision of strength and endurance. This year, we are all being called upon to endure a bit longer, and the reasons could not be more important: to save lives and end this pandemic. Also, this week through Sunday is National Nursing Week, when we acknowledge the unrelenting dedication, expertise, and vital role of Canada's nurses across the expanse of health and public health. We're all aware of the skilled and caring touch that nurses provide, whether it's administering vaccines to keep us well or caring for us from illness through recovery. But nurses are also working behind the scenes, contributing to the safeguarding and advancement of our health and wellness, from research and scientific studies to writing essential practice guidelines for health professionals. They have also been instrumental to the public health response to COVID-19 through contact tracing, screening at quarantine sites, and so much more. For the innumerable ways they work to keep us safe and healthy, we are grateful. And considering the ongoing and difficult period that our healthcare workforce is working through and the unrelenting pressure that this third wave is placing across the health system, there are hardly the words to thank them enough. The end of a challenge can feel like the greatest test of our endurance, but in fact, this is a powerful moment for us to show collective strength. The deepest gratitude we can show those who have helped us this far through this long and difficult crisis is to keep following their advice as vaccines continue to roll out and have more impact. For now, we need to remain cautious and do everything that we can to protect ourselves and our communities, ease the pressure on the system, and help bring an end to this pandemic. This includes making an appointment to see your friendly neighborhood nurse and rolling up your sleeve for the COVID-19 vaccine as soon as you are able. Thank you.
Bonjour à toutes et à tous.
Good morning, everyone. National trends are slowly declining, but we've still got a number of areas across the country that are experiencing ongoing resurgences. Over the past 7 days, an average of 7,275 cases have been reported daily, and the number of people experiencing severe and critical illness remains high. On average, 4,000 people with COVID-19 were being treated in our hospitals each day, including over 1,400 in intensive care units, and there were an average of 49 deaths reported daily. This week, Muslims across Canada and around the world will end their month-long fast of Ramadan with the feast of Eid al-Fitr, a spiritual celebration acknowledging the provision of strength and endurance. This year, we are all being called upon to endure a little bit longer, and the reasons could not be more important: to save lives and end this pandemic. Also, this week through Sunday is National Nursing Week, when we acknowledge the unrelenting dedication, expertise, and vital role of Canada's nurses across the expanse of health and public health. We're all aware of the skilled and caring touch that nurses provide, whether it's administering vaccines to keep us well or caring for us from illness through recovery. But nurses are also working behind the scenes, contributing to the safeguarding and advancement of our health and wellness. From research and scientific studies to writing essential practice guidelines for health professionals. They have also been instrumental to the public health response to COVID-19 through contact tracing, screening at quarantine sites, and so much more. For the innumerable ways they work to keep us safe and healthy, we are grateful. And considering the ongoing and difficult period that our healthcare workforce is working through, and the unrelenting pressure that this third wave is placing across the health system, there are hardly the words to thank them enough. The end of a challenge can feel like the greatest test of our endurance. But in fact, this is a powerful moment for us to show collective strength. The deepest gratitude we can show those who have helped us so far through this long and difficult crisis is to keep following their advice as vaccines continue to roll out and have more impact. For now, we need to remain cautious and do everything we can to protect ourselves and our communities, to ease the pressure on the system, and to help bring an end to this pandemic. This includes making an appointment to see your friendly neighborhood nurse and rolling up your sleeve for the COVID-19 vaccine as soon as you are able. Thank you.
Thank you, Dr. New. The Prime Minister will be taking 6 questions, starting with the phone. 1 question, 1 follow-up. Doctors and Minister Leblanc will remain available for 15 minutes afterward. Merci beaucoup, Dr. New. Le Premier ministre prendra 6 questions en commençant par le téléphone. 1 question, 1 sous-question. Le ministre Leblanc et les docteurs demeureront disponibles pour 15 minutes par la suite. Opérateur, c'est à vous.
Merci.
Operator,
Thank you.
your floor.
Please press star 1 at this time to ask a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question est de Raymond Filion de TVA. La parole est à vous.
Filion, TVA, you have the floor.
Merci.
Thank
Monsieur le
you.
Premier ministre, est-ce que vous avez des
Prime
assurances
Minister,
à cette
do you have
heure-ci que la
reassurances
canalisation 5 d'Enbridge ne
that
fermera pas comme promis par la
line
gouverneure du
5
Michigan? Sinon, à quel point ça
for
vous
Enbridge
inquiète
will not be
cette
closed by the
possibilité?
governor of Michigan? How are you
Nous
worried
sommes
about
très préoccupés par
How
le
worried are you about
potentiel
this?
d'une fermeture
Answer.
de la ligne 5.
We
C'est pour
are
ça
very
que nous
concerned
travaillons
about the
depuis des
possible
mois
closure of line 5.
avec
That is why we've been
nos
working for months
homologues
with
aux
our
États-Unis,
counterparts in the
qu'on
United
encourage
States,
la
and we are
médiation directe
encouraging
entre
direct
la compagnie
mediation
Enbridge
between Enbridge
et
and
l'État de Michigan.
the state of Michigan.
Et on va
And
continuer
we will
de faire
continue
partie de ces
to be
discussions
part of these
et
discussions
d'encourager
and
une résolution qui ne
encourage a
mettra
resolution
pas
that
en insécurité
will not
énergétique
endanger the energy
nos communautés
security
des deux bords de la
our
frontière.
communities on both sides of the border.
En suivi, Raymond?
Follow-up, Raymond?
Est-ce que vous avez personnellement soulevé la
Question.
question
Have you
auprès de Joe
personally
Biden?
raised the matter with Joe
Oui,
Biden?
c'est un enjeu dont on
Answer.
a
Yes, it
discuté,
is an
la
issue that we
sécurité
discussed.
de nos échanges en énergie, des
Security of our
pipelines,
energy
mais
exchanges
nous
and
reconnaissons que
pipelines,
c'est un
but we
processus
recognize
en
that it
médiation
is
entre
a process that
Enbridge
is
et
currently
le
under
gouvernement
mediation between between
l'État
Enbridge
du
and
Michigan. Nous,
the
on va continuer
Michigan
de
government.
participer
We will
et de
continue
faire
to
valoir
participate and
nos
promote
préoccupations
our
à
concerns
travers l'ambassade à Washington
through the
et
embassy in
nos autres
Washington
engagements.
and our other
Nous suivons
commitments.
évidemment la
We are
situation de très
obviously
près.
following the situation very
Thank you.
closely.
We continue to engage very closely in the issue of Line 5. We know that it is a matter of energy security for Canadians and for Americans. This is why we have pushed strongly for the mediation process between Enbridge and the state government in Michigan to continue. We will continue to weigh in through our embassy in Washington and with our partners, because we know that the energy cooperation and partnership between Canada and the U.S. is good for citizens on both sides of our border.
Thank you, Prime Minister. Operator, next question on the phone.
Merci, thank you. The next question is from Ryan Tumulty of the National Post. Please go ahead.
Yeah, good morning, sir. I wanted to ask you about the AstraZeneca vaccine. There are more and more experts coming out and suggesting that it might not be a good fit for Canada's vaccine rollout, and that with our supplies of mRNA vaccines, we should back away from it. Do you still think it's going to be a significant part of our vaccine rollout?
One of the things we knew from the very beginning, Ryan, was the best approach on vaccination, particularly when we were talking about last summer when we didn't know which vaccines would land, which ones would be most effective, who would develop them, was to ensure a diversified portfolio. And that's why we have so many different types of vaccines available around the world, but also to Canadians. But every single vaccine that is delivered in Canada has been determined to be safe and effective by Health Canada. What we are encouraging Canadians to do is to get vaccinated as quickly as possible. Sign up for that first dose and take whatever vaccine is offered to you. Now, we know that we are receiving far more mRNA vaccines than we are of the AstraZeneca and Johnson & Johnson for now, but we will continue to monitor, and quite frankly, provinces will continue to make determinations about the exact details of their vaccine rollouts. From the federal government's perspective, our job is to make sure that we get the largest number of safe vaccines into Canada as quickly as possible, which we're certainly on track with close to 50 million vaccine doses that'll have arrived in Canada by the end of June, and enough vaccines for everyone to be fully vaccinated by September. Nous avions reconnu que c'était très important d'avoir un portfolio diversifié en termes de vaccination et de vaccins potentiels. C'est pour ça qu'on a signé des accords et on est en train de recevoir beaucoup de différents types de vaccins. Mais je peux rassurer les Canadiens que chaque vaccin qu'on administre au Canada
has been administered in Canada has been deemed safe and effective by Health Canada.
La santé et la sécurité des Canadiens
The health and
est
safety of
toujours
Canadians
la
is
chose la plus
always
importante.
the
Et c'est
number
pour ça
one,
qu'on
and
encourage
that
les
is
gens
why
de
we
se
are
faire
encouraging
vacciner
people to
le
get
plus
vaccinated
rapidement
as quickly as
possible pour qu'on puisse
possible
passer à
so
travers
that we
cette
can
pandémie.
get through this pandemic.
Les provinces et
The
les
provinces and the
territoires
territories
prennent des
are
décisions par
making
rapport
decisions
à
with respect
leur
to
choix de vaccination
their
et
choice of vaccines
leur catégorie de
and their
vaccination.
categories of vaccinations.
Notre responsabilité du côté
Our
du fédéral, c'est de
responsibility in the
livrer
federal
le plus
government
de
is to deliver as many vaccines
possible.
as possible, and that is why we're talking about 50 million
qui seront arrivés au Canada
doses
pour la fin juin,
that will be arriving by the end of June,
assez de doses pour
and
que
enough
tous les
doses
Canadiens
for
soient
all
vaccinés
Canadians to be
complètement
fully
pour
vaccinated
septembre.
by September.
Following up, Ryan?
Yeah, sir. I'm also wondering, you talked in your opening remarks about, a one-dose summer and the need to keep public health restrictions in place until our vaccination numbers come up. Do you think there is widespread agreement with premiers across the country? Do you expect they will keep restrictions in place until the numbers come well down in order to set up this scenario you're forecasting?
Well, I think people are eager to see what a better summer could look like. And a summer in which the vast majority of Canadians have received one dose with caseloads down across the country will allow us to gather and have barbecues with friends. We'll still have to be careful in a lot of different ways, but it will be a slightly better summer. That's why we're talking about a one-dose summer. But what we also know from previous waves is it's really important to get public health measures right and drive cases down. Vaccinations alone, one dose alone, won't allow us to have a good summer. We have to get those case numbers down. We need to crush COVID right across the country, and we need to get vaccination rates up over 75%. of one dose. I know we can do that. We have enough vaccines, and Canadians have demonstrated a capacity to get those community transmission cases down. We just need to do those two things over the coming weeks so that as we get into summer, we'll be able to have a better situation.
Thank you. Operator, dernière question au téléphone.
Last question over the phone.
Merci. La question suivante est de Hélène
Buzetti,
l'Écope de l'information. La parole est à vous.
Oui, bonjour, Monsieur Trudeau.
Yes,
J'aimerais
Mr.
revenir
Trudeau.
sur cette
I would like to
question
come
de
back to
la
this
preuve
issue
vaccinale
of,
pour accéder, par exemple, à une terrasse, un café, un restaurant ou un cinéma.
Patio, or to go to the
J'aimerais
movies,
savoir,
or to go to a restaurant.
philosophiquement, êtes-vous d'accord avec l'instauration de telles preuves vaccinales? Vous avez dit dans le passé que vous pouviez envisager des problèmes éthiques. Pouvez-vous être plus, donner plus de détails sur quels sont les problèmes que vous envisagez?
Merci, Hélène. Évidemment, c'est une question importante, mais aussi délicate.
Issue, but it's a delicate one as well. We want to encourage as many people as possible to get vaccinated because that is how we will get through this pandemic. We saw it in other countries that a certain level, there's a plateau of vaccinations in the population that is still too low to really provide security. We need to reach over 75% of Canadians vaccinated with the first dose, and we need to continue administering second doses to have a one-dose summer. To do this, there are many people who are looking at the idea that with proof of vaccination we could do more things. Certainly for international trips, that will be very important. But for domestic usage, I know that some provinces are looking at this. There are always concerns about fairness. Does everyone have access to vaccination? Does everyone have the same ability to get vaccinated? First of all, vaccines are free. They're paid for by the federal government, so that removes some concerns of fairness. But we also see that some communities or some cultures are a bit more reticent to get vaccinated. We want to strike the right balance. We want to encourage everyone to get vaccinated as soon as possible and to have more freedom after they get vaccinated. That could be part of it. But we need to ensure that we're not being unfair to people who are already marginalized or vulnerable, or perhaps a bit more reticent. So the discussions are ongoing between the different levels of government, and we are looking at how we can do this right and ensure that it's a positive thing to encourage people to get vaccinated without harming or disadvantaging some groups of people. That is the concern that we all have.
Je vous entends très bien, merci. Mais sur la question philosophique, par exemple, de cette idée d'avoir, dans le fond, décliner une information médicale à propos de soi,
sharing medical information or one's identity to merchants and this issue of privacy or Big Brother. What do you think about that? Answer.
On puisse passer à travers cette pandémie,
we can get through this pandemic,
faut se faire vacciner.
But we need to do so through vaccination.
And the
vast majority of Canadians will need to get vaccinated. And it's not just a question of protecting ourselves. We need to reach the threshold that will protect all of society and all of the community. I understand that we might not want to share private information about someone's health. But this proof of vaccination, this information that someone had a vaccine or not, I think that because it has such a huge implication for public health, if we reach this 75%, 80% goal, I think that it's information that we should share, be able to share, but while being careful to not share the medical situation of some people who can't get vaccinated because they're compromised or something else. We need to create a way where we're not infringing on privacy, but vaccination is something that's important for everyone, and I think that we should be able to share that information. But as I said, again, the conversations are ongoing, and they are we are being experts who weigh in on both sides of the
I think it's really important to encourage Canadians to get vaccinated. We know we're not going to get through this pandemic until enough people get vaccinated. 75%, 80%, even more get first dose and second dose. So anything we can do to encourage people to get vaccinated is going to be important. And that's where the idea of proof of vaccination for different services or better access is something to look at, particularly because vaccines are free. They're paid for by the federal government. There is going to be enough vaccines for everyone in the population. We just have to reflect upon certain communities or vulnerable Canadians who might still have more difficulty accessing vaccines or might have resistance to vaccinations because of cultural or other realities that we have to be thoughtful about as we move forward. And then when it comes to the privacy aspects of proof of vaccinations, vaccinations aren't just about protecting the individual. They're about protecting all of society, and particularly vulnerable individuals who, for medical reasons, can't actually get vaccinated. So it matters to know that Canadians are getting vaccinated. And I think we should be able to walk the path between respecting someone's privacy, but also understanding that whether or not someone's vaccinated is something that we should be able to make use of to both encourage people to get vaccinated and keep all Canadians safe.
Thank you. We'll now take questions in the room.
Good morning, Prime Minister. Tonda McCharles with the Toronto Star. Can I go back to what your remarks about one-dose summer, two-dose fall? We've had national guidance on masking. We've had national guidance on immunization. And I'd like to understand what you think, or if you even think there's a need for a national reopening plan that uses some of these markers. I mean, are you contemplating giving guidance to the provinces on case counts per 100 or whatever, like the case may be? I don't hear that kind of specificity. And already Saskatchewan is kind of ditching the 75% first dose. They're saying 70 is good enough.
I think it's really important that Canadians understand that we could have a much better summer if two things happen. If the case counts get under control across the country, if we're able to crush COVID and keep those case counts really low with adequate measures around screening and contact tracing and isolating whenever there are pop-ups or outbreaks that will happen from time to time. We need to get cases down, and we've seen from waves in the past the problems that happens if restrictions are opened too early. It just leads to a greater next wave. So the first thing we need to do to make sure we're getting into a one-dose summer where people can be a little freer and have a little bit more normal summer with friends around the barbecue is case numbers need to be down right across the country. And local public health officials will make determinations about what under control and what case counts are. It could vary a little bit, but the cases need to be down. Secondly, Canadians have to get that one dose. Canadians have to get vaccinated to over 75%. And if we have those two things, if case numbers are down and if over 75% of people get vaccinated, we can have a summer that'll be much better for everyone. And that's sort of on all of us. Different orders of government. The federal government needs to make sure, as we are, that we have enough vaccines for everyone to get one dose before the end of June, which we will, and that second dose continues to increase in terms of being delivered. That provinces keep the restrictions necessary in place until they get the new cases totally under control and are able to handle and respond to any little outbreaks that we know will happen. And third, Canadians need to get vaccinated. We have more and more vaccines coming in. We're going to be able to have enough doses so that we can have that one-dose summer, which will set us up for a two-dose fall, which will be much, much better. But everyone needs to do their part. get the case numbers down and keep them down, and get vaccinated. That's how we get through this.
Next question.
Hi, Prime Minister. Stephanie Taylor with the Canadian Press. Going back to AstraZeneca for a second, given that experts have said that mRNA vaccines are the preferred ones and there are ongoing safety concerns with the AstraZeneca shot, will Canada stop negotiating with the United States to get their doses of AstraZeneca and instead ask for, say, Moderna?
We're going to continue to talk with all our partners about ensuring that we're able to get Canadians through this as quickly as possible and as safely as possible. We will continue to work with the United States, with other countries around the world to ensure that we get enough doses to get Canadians vaccinated with 1 dose before the summer and that second dose through the summer so that we can have a much better fall. But on the safety concerns, I'm happy to turn to Dr. Tam to speak to that.
Thank you for the question. And I think that, as the Prime Minister said, it's really important to increase vaccine uptake because it's going to play a really important role in helping us control the pandemic and reduce the risk of resurgence. I think he provided a really important point in terms of getting the cases down at very low levels so that we can, provinces can actually test, trace, isolate, and put out these more targeted approaches so they're not going back into the fall with the more restrictive measures. That's this sort of vision going forwards. And in terms of, AstraZeneca, I think what I would say is, first of all, remind everyone that anyone who got the AstraZeneca vaccine did the right thing in protecting yourself and those you love and those around you. Of course, we have to take any reports of serious side effects, however rare, very carefully. So that's what is being done. And so that Canadians can have the appropriate information to make informed choices, and the provinces can design their programs. But what I would say is that, right now, the National Advisory Committee on Immunizations is recommending 2 doses using the same vaccine. So we will make sure that those who got the AstraZeneca vaccine, the first dose, can be provided with a second dose. At the same time, we're following the evolving science, including the studies from the United Kingdom, to provide the most up-to-date advice on whether a mixed-dose schedule is the appropriate way to go. And that would offer a choice, essentially, for those who have received AstraZeneca for the first dose. And so I think the bottom line is we take any reports of serious adverse events very seriously, and that is being taken into account as we design our programs going forward.
Next question.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada. Je veux revenir sur la ligne 5. Si la médiation échoue entre Enbridge et le Michigan, le Canada va-t-il invoquer le traité de 1977 entre le Canada et les États-Unis qui limite les actions unilatérales dans ce qui est question de transport de ressources, de pipeline? Est-ce que vous allez utiliser cette option-là?
Nous reconnaissons à quel point on est interdépendants,
interconnected with the United States in terms of energy. And that is why we are working very closely with the Americans on this issue. I know that the Minister of National Resources, Minister Regan, will be making an announcement very soon to discuss about our position on the matter and our concerns about the situation. We will always do what is necessary to protect Canadians' interests, to defend the energy security of Canadians.
On va avoir plus à dire dans quelques heures.
We'll have more to say in a few hours.
I can assure you that we are watching very, very carefully the situation with Line 5, as we have for many, many months. We've continued to engage on it, and Minister of Natural Resources, Seamus O'Regan, will be out shortly with an announcement on further engagement by the federal government to ensure that we're defending Canadian interests and Canadian security.
Glenn McGregor, CTV News. Prime Minister, you've repeatedly told Canadians not to travel abroad. Earlier this month, your foreign minister was in the UK. He's headed back to Iceland later this month, even before his 14-day quarantine period is up. You've talked about the possibility you're going to go to the UK for the G7. What do you say to Canadians who have put off travel, maybe to go to funerals or to see family around the world, when they see that's a mixed message, that people in cabinet are traveling, but they're not allowed to?
We continue to highlight the need for essential travel. There are thousands of trucks with food and essential goods across the U.S. border every day. We continue to see essential travel happening. The question always remains, what is essential travel and are the rules going to be followed? We had to make sure that we kept Canadians safe when we shut down the borders to non-essential travel for non-Canadians over a year ago now. And Canadians and people around the world have responded. We have seen a drop in over 95% in travel volumes over this past year, and that has kept Canadians safe. But there are moments where essential travel is necessary, and those decisions will be made. But at the same time, all proper safety protocols will be followed. All quarantines and testings will be abided by because nobody is exempt from keeping Canadians safe.
For you and Minister LeBlanc, possibly, the Justice Minister in Alberta made some comments last few days about how the provincial NDP and the media and the federal Liberals wanted to see Alberta's provincial health system collapse during the pandemic. Wondering what your response is to that and whether it colors your relationship with Alberta as you try and work through the pandemic.
I think it's a shame to see people pointing fingers and laying blame and suggesting that anyone in Canada wants anything else than to get through this pandemic as safely as possible everywhere. Last week, I reached out directly to the Premier of Alberta, to the mayors of Calgary and Edmonton, to continue to offer all the help that the federal government could possibly offer to help Albertans and indeed all Canadians get through this. Every step of the way, the federal government has been there to support Canadians, with 8 out of every $10 in pandemic support coming from the federal government. We will continue to work with Canadians. We will continue to work with all governments across this country to make sure we're getting through this. That's what Canadians want to see. That's what the federal government wants to see. That's what opposition parties want to see. And that certainly is what the media is focused on as well. I think playing politics at this point is just not what Canadians want to see. Je pense que c'est très clair qu'il y a personne.
I think that it's very clear that no one in this country wants anything other than to get through this pandemic with as little tragedy as possible. Across the country. As a government, we have always been there for all the provinces and territories. Last week, I spoke with the Premier of Alberta. I spoke with the mayors of Edmonton and Calgary to repeat for the umpteenth time that the federal government will always be there to help with whatever is needed. We helped Albertans, we helped workers. 8 out of $10 of pandemic money has come from the federal government, and we will continue to be there for Canadians. I think it's unfortunate to see people trying to play partisan politics because no one wants anything other than to get through this pandemic safely, whether it's governments, the opposition parties, or the media. We will all continue to work together because that is what Canadians need and that's what they expect of us.
One last question.
Salima Shiv, GCBC. I want to ask you about what's happening in the Middle East. So Canada's policy on Israel and Palestine is predicated on the existence of the Oslo peace process. A lot of experts say that process has been dead for years and doesn't reflect the reality on the ground. The reality on the ground is renewed tensions. So with that in mind, what do you say to what we are seeing in Jerusalem as well as in Gaza, the exchange of rockets and airstrikes in which 9 children are among the casualties?
The violence and deaths we've seen in Israel right now and in the region are terrible. There needs to be de-escalation immediately. We need to see a cessation of violence and attacks. The rocket attacks from Hamas are absolutely unacceptable. But we're also gravely concerned about the settlements and the evictions of Palestinians. We need to see a return to conversations and dialogue and de-escalation, an end to the violence, including the violence at the Al-Aqsa Mosque, which are just heart-wrenching. We need to see a path towards a two-state solution through negotiated conversations. Any unilateral, unhelpful actions on either sides are not contributing to the kind of future we all need to see.
Merci, Monsieur le Premier ministre. C'est tout le temps que vous avez avec nous aujourd'hui.
Thank you, Mr. Prime Minister. That is the
On va maintenant
end of
continuer
your
la conférence de
availability.
presse
We will now
avec le
continue the press
téléphone
conference
opérateur.
on the telephone operator.
Operator?
Thank you, merci. And yes, the next question is from Brian Mullen of Global News. Please go ahead. Oh, actually, and we have lost him. Et la question suivante est
The
de
next question
Catherine Lévesque, la
is from
presse
Catherine
canadienne. La parole est à vous.
Lévesque, Canadian Press. You have the floor.
Oui, bonjour, merci beaucoup.
Yes, good afternoon. Thank you very
Une
much.
question peut-être soit pour les docteurs,
I
soit
have
pour
a question
Monsieur
either for
Leblanc.
the
Je veux
doctors
juste
or
revenir
Mr.
là,
Leblanc.
sur
I'd like to come back
cette première dose cet
to
été,
the
ces
first
deux
dose
doses
summer
à l'automne. Je me
and
demandais, est-ce
two
que
dose
le
fall.
gouvernement
I was
maintient
wondering whether
toujours,
the government
en fait, la date limite là, de septembre,
is
dans le
still
fond, les Canadiens
maintaining
seront
the
pleinement
September
vaccinés
deadline
en
for Canadians to be
septembre.
fully
Je me demandais si on
vaccinated.
pouvait avoir plus de
I would like to
précisions
know
peut-être
if
sur
we could get a bit more
l'échéancier, là,
details on the
quand
numbers
tous
for
les
that.
Canadiens auront reçu leurs 2 doses.
Whether all Canadians will have received 2 doses by that date. Answer. I can perhaps offer a few comments and then Doctors New and Tam can jump in. Minister Anand and the Prime Minister have always been clear that by the end of June, 48 to 50 million doses of approved vaccines will be received, and that will allow all Canadians who wish to obtain a vaccine to receive at least their first dose by the end of June. And during the summer, we will receive enough doses for all Canadians who wish to be fully vaccinated and that's obviously with 2 doses, to do so, and that all of that will be done by the end of September. Obviously, if the provinces are able to roll out the vaccines quickly and Canadians register as quickly as possible, it may be that by the beginning of September, all Canadians will be fully vaccinated. But we are certain that we will have the vaccines for all of this to be finished by the end of September. Thank you. This is Dr. New. There's not much else to add to what Mr. Leblanc already noted. We are continuing to work closely with our counterparts in the provinces and territories with the delivery of vaccines here in Canada. We are more stable and we are impatiently awaiting the other doses arriving in the country. So it's really a matter for the provinces and territories where they are continuing their planning with the vaccines arriving in their jurisdictions, and they are planning to offer vaccines to all of their inhabitants. For us, if we're talking about the public health perspective, it's one thing to offer the vaccine, but it's also something to look at vaccine acceptance, because we know that here in Canada, with the polling, it's encouraging that most Canadians, I think their last poll saw over 80% of Canadians indicated that they wanted to receive the vaccine. So that is something to follow. But for us, it's also a very important target, because vaccines need to not just be delivered to the provinces and territories, but also administered. For us, that's great news. We're hoping for a better summer than last year's. Follow-up, Catherine?
Oui, sur un autre sujet,
Yes, on another subject. Minister Leblanc, I like to come back to C-19. How do you justify limiting debate on this pandemic election bill? Do you think that there will be an election in the fall? Answer, no, not at all. We've always said, we've said for months, that we are not looking to trigger an election. We want to remain focused on the necessary assistance for helping Canadians through the pandemic. However, the Chief Elections Officer asked Parliament to look at some temporary measures that would apply if an election were triggered during the pandemic. And I would remind you that there have been another number of provinces that have had elections during the pandemic. So the Chief Elections Officer, who has a legal mandate to ensure that Elections Canada is ready for by-elections and general elections at any time. It is only prudent in a minority parliament. He asked Parliament to consider temporary measures to give more tools to Elections Canada to protect not only those who are going to vote, but also the 250,000 people who help administer the elections all across the country. So we think that the Conservatives will evidently not allow the debate to conclude. They are extending debate on this bill, and we believe that Parliament must remain focused, for example, on the budgetary measures that will directly help Canadians and the provinces get through the pandemic. So that is why we deemed it necessary to allow the House Procedure Committee to look at the bill, to make improvements and amendments to the bill that it deemed important, and then the parliamentary process will continue. But at the same time, the Bloc Québécois is still voting to not support the confidence of the government. So in the government, we are not losing confidence in our government, but the Bloc and the Conservative nearly always are trying to trigger elections. So we think that it's prudent for the committee to look at this bill.
Thank you. Operator, we'll take one last question on the phone.
Merci, thank you. The next question is from Eureka Walsh of the Globe and Mail. Please go ahead. Your line is open.
Good afternoon. My question, I think, is for Minister LeBlanc. I'm wondering if you can just explain a bit more what the government's approach is right now on purchasing AstraZeneca. Can you confirm if the government is still trying to, as was repeated last week, push for earlier and more deliveries of AstraZeneca right now?
So our government has, from the very beginning, once Health Canada approved vaccines as being safe and effective for Canadians, obviously we've done everything possible to get as many of those vaccine doses into Canada as quickly as possible. We are happy that Canadians were impatient to receive the vaccines, that provinces have done a great job in preparing vaccine rollout plans. So we continue to work with all of our suppliers with whom we have contracts to bring as many doses of vaccines that are safe and approved for Canadians to Canada as quickly as possible. With respect to AstraZeneca, we expect 665,000 additional doses of AstraZeneca to arrive in the coming weeks. And there's also another 1 million doses we have under contract with the company that we expect to arrive in Canada in the month of June. So our policy of accelerating as many doses as possible, as quickly as possible, and be able to deliver them to provinces and territories, our priority has not changed.
Following up, Marika?
Thank you. Yeah. So can you explain to Canadians, as we see provinces reconsidering the use of AstraZeneca, and Alberta being the first one to say it won't book for shot appointments for AstraZeneca, why are you still pushing for more AstraZeneca at this time?
Well, because as the Prime Minister stated a few minutes ago, the best way to ensure that all Canadians who want to get vaccinated can get vaccinated as quickly as possible is to have a diverse supply of vaccines from different parts of the world. 7 different companies have signed agreements with our government. So we'll continue to pursue that very basic strategy of having a diversified portfolio of vaccines with hundreds of millions of doses under contract to come to Canada. I'll also note that my colleague, the Minister of Procurement, discussed arrangements that have been made for vaccines in 2022, 23, potential booster shots. So that work is ongoing and will continue. But we have a contract to receive AstraZeneca vaccines, and provincial health authorities will decide the way that they, in their judgment, see those vaccines best administered to their populations. But it would be irresponsible for Canada not to pursue the 665,000 doses of AstraZeneca that we expect to get in the coming weeks, and the 1 million additional doses that we'll get in the month of June. And those vaccines will be distributed to provincial authorities to be administered to the populations that they decide in their best judgment should receive those vaccines.
Thank you, Minister LeBlanc. We'll now finish in the room.
Good morning, Tonda McCharles, Toronto Star. I think this question is for Dr. Tam. Dr. Tam, I wonder if you can tell me, is it the view of the Public Health Agency of Canada that a national reopening plan that provides national guidance on reopening benchmarks is not needed, and that the government ought to defer to the provinces on all the benchmarks in terms of reopening?
Thank you for the question. And at the Special Advisory Committee with the other Chief Medical Officers of Health, it's pretty clear, I think, the kind of indicators that are needed to be tracked in order to do safe reopening. And as you can imagine, those indicators helps us track that we've got the third wave, for example, under control in terms of cases, the rates, the reproduction numbers, the hospital capacity, the public health capacity to test, trace, and isolate. Those are not new. They are indicators that we all think are important to track as people are looking at reopening, and do it slowly and gradually, because if not, and a resurgence can happen, especially the vaccine coverage isn't high at the moment. So I think, as the Prime Minister said, those kind of indicators are important. And every province, of course, have a very different context. And they need to take into account and track all of those parameters as they move along. I hope slowly, deliberately, and carefully, because this is, I hope, our final challenge. If we can keep on suppressing the cases and get the vaccines up, we will have a year that looks considerably better moving ahead. But that's both important. I think the other message is really not to just rely on the vaccine uptake number. Those cases have to come down as the vaccine doses are going up. But the vaccine indicator is important to track. It gives us an idea of the population protection, immunity, and some of those indicators and those numbers come from modeling, as you probably know, and a lot of parameters are thrown in, but a 75% target for that first dose, moving as fast as possible to the 2-dose, is an important indicator to track alongside the epidemiologic ones.
And so I take from that then that your view is not to advise the government that it needs a national reopening plan. And if I'm wrong in that understanding, please correct me. And I just, my I guess follow-up is the whole musings about the first dose, second dose, and the whether or not, I know you're waiting for the UK study, but whether or not it can be a mixed dose schedule. Have you contemplated that maybe the advice is a stick to the same dose? And if you have, what are you projecting for the national vaccine rollout, given the difficulties in sourcing AstraZeneca for those who've got already a first dose of AstraZeneca? Does that make sense?
Yes, so we know that overall, to date, roughly, I think 2 million people would have got the first dose AstraZeneca. And as I said, they made the right decision for themselves and also for those around them. And the amount of vaccines coming in that Minister LeBlanc has described is expected to essentially provide a second dose using the same vaccine for those who already received a first dose for AstraZeneca. And I think we can commit to those vaccine recipients that second dose will be there for them because that's the current advice. But I think it is important to follow the clinical trial data and be able to offer a option for those who've already received that first dose. And we're looking forward, hopefully, to see that data in a number of weeks. And I think the United Kingdom officials have provided some context of when that might be possible. And I think the key being that before this first group of people who receive AstraZeneca vaccine is due for that second dose, we'll be able to provide that advice to them.
Next question.
Hi, Dr. Tam. Stephanie Taylor with the Canadian Press. There's a growing call from some provinces, or for some provinces, to relent on the public health restrictions on outdoor activities to allow more people to do things outside. Given that the risk of transmission is low, should and can provinces start to look at relaxing restrictions specifically outdoors before perhaps achieving that 70 or 70% benchmark yourself and other local chief medical health officers are working with?
I think, again, this is just one key benchmark, and I think it's very important for people to have a target to shoot for. At the same time as it is the decision on very localized public health measures must be done with the data that they have locally. They have to be able to suppress those cases because otherwise I think it's very difficult to ensure that cases are tracked, where they got the infection from. Having said that, the outdoors is definitely safer than the 3 C's, closed, crowded, close contact environments. When you're spending a lot of time together, those are the last ones that could probably be going back to normal. But outdoors, so as the Prime Minister said, towards a summer where you can have more activity outdoors, particularly with those that you in your household or small groups, and be able to do some of those activities very important, as well as, of course, physical activity and mental health. So I think the outdoors should be the first stage or included in that first stage of having people do more. As to exactly the level of vaccination target, we're giving a benchmark, but I do know that the provinces have more complex calculations on the epidemiology, including for example, how much immunity there exists in their particular population. Provinces that have encountered a lot of COVID activity might have more people already infected. And so they've taken some of those kind of calculations as they are looking at their vaccine targets. But I think it is important for everyone in Canada to have something to keep their eye on so that we know that there is a path forwards that is much more positive and hopeful.
Thank you. We'll take one last question in the room.
This is a question probably for Dr. Tam and Dr. New. We're seeing provinces like Alberta decide to delay, to no longer give AstraZeneca as a first dose and save them for the second dose just because of supply demands. I wonder if that, do you think that's an effective strategy that all provinces should be doing at this point in time?
I think provinces are in the best position to look at how to best use all the vaccines they have available to them. What I do know is that there's not that much left of the existing AstraZeneca supply. So some provinces are thinking that, okay, well, we might know that 655,000 is coming in soon, and then, we're expecting more, but that they feel that as a prudent measure, that they would keep the small amount that they have left in order to ensure that second dose for those who already have it. And that would be up to them in terms of planning purposes. It is difficult for people when, they as the schedules are being firmed up, they can feel more, confident about how they plan those vaccine rollouts. But I think it is different between jurisdictions because some actually doesn't have any AstraZeneca left and are waiting for the expected the next 2 deliveries.
Merci beaucoup. C'est ce qui m'a fait la conférence de presse d'aujourd'hui.
Thank you very much. This brings today's press conference to an end.
Conference is now ended.